Trying to decide between a lumpectomy or mastectomy for your breast cancer? We will teach you all about it. If you've been diagnosed with a small, early-stage breast cancer, you will ultimately have a difficult decision to make. Choose a lumpectomy or a mastectomy. A lumpectomy followed by radiation therapy is used more and has the same survival as a mastectomy, but ultimately the choice is yours. In this lesson, I'm going to teach you about a lumpectomy and a mastectomy surgery. I'm going to also share with you why surgical decisions can be very complex to make for both you and your breast surgeon. I'm also going to share with you that you have time to make a surgical decision, especially if you are unsure, and do not feel pressure to do so. I'm going to explain why some women in unique situations choose a mastectomy over a lumpectomy when a lumpectomy is a great surgery and has the same outcome. And I'm also going to give you the suggestion that if you are a candidate for genetic testing, the BRCA mutation, the breast cancer gene, you should consider asking your doctors about getting it before surgery. So let's get started. So what is the difference between a lumpectomy and a mastectomy? Well, I want to just briefly walk you through both procedures. If you have a small tumor, an early stage breast cancer, you will likely be a candidate for a lumpectomy. In essence, to keep the breast, but remove the tumor from the breast. But if you have a lumpectomy, you will most likely benefit from having some radiation therapy to the breast tissue to lessen the risk of something growing back in the breast and keep that risk of recurrence low, an acceptably low rate. A mastectomy is when, even for a small tumor in this situation, you remove all the breast tissue. You can keep the skin, you can reconstruct the breast with an implant or your own tissue. It's a much bigger surgery. It involves reconstruction for most women. You lose sensation over the skin. And generally, it can take 1, 2, or 3 surgeries to get you to a point where you're reconstructed and back on your feet again. So a lumpectomy, an outpatient procedure, come in, have it done, go home, hopefully the only surgery. Mastectomy, a bigger surgery, generally stay overnight, longer recovery, multiple surgeries. So the benefits are fairly obvious. The downsides, the risk to both. A lumpectomy does require radiation therapy after surgery. A mastectomy for a favorable early stage cancer generally does not require radiation. So I guess that's sort of an advantage towards a mastectomy. But it's a well-tolerated treatment and we do it all the time. Outcomes. Who lives the longest? Or shall we say, will a mastectomy cure me more than a lumpectomy for my small early stage breast cancer? And the answer is no. The survival rates for a lumpectomy followed by radiation or a mastectomy no radiation for the same type of tumor is exactly the same. So why is this such a complex decision? Otherwise it seems pretty simple. Well, breast cancers present in many different forms and fashion in vastly different patients and people. Some are strong, some are young, some are old, some have a lot of health conditions, some have a very small breast, some have a very large breast. All of these play factors. So let me give you a couple examples. Size. If you have a very, very small breast and you have a cancer the size of a golf ball, it is going to be very difficult to remove the golf ball sized tumor with a lumpectomy, get a good margin, and actually leave much breast tissue behind. It's just one. Let's say your breast is really large and radiation becomes somewhat difficult to do in that setting and has a higher rate of complications. It might make you choose a different surgery. Let's say you present with one lump, but then we find another cancer in that breast with subsequent imaging or a breast MRI. Well, you were going to have a lumpectomy, but because there's a second cancer far away from the first, you may benefit from a mastectomy. Let's say you come in and your family history is screaming that you're at high risk for carrying the breast cancer gene, the BRCA mutation. That's where you can step back, plan your surgery, but also do genetic testing before surgery. And if it comes back positive, whereas otherwise you would have had a lumpectomy, you might consider the option of a mastectomy on both sides to reduce your future risk of developing a new breast cancer. So these decisions are complex, involve many different factors. And what I like to tell you, this is what you really are paying your breast cancer surgeon for. Their insight and their guidance for you on your initial surgery and initial treatment course. You have time and do not feel pressured to make a surgical decision when you're not ready. Let's talk about time first. In some ways, it feels like the process of getting a diagnosis and getting to surgery is a real rapid one. You're going through different aspects, you're learning more about your breast cancer care, or one thing after another. You feel in some ways like it's a crazy rush to the finish line. And in other ways, it seems like it takes forever to get to surgery because you want to get the cancer out. But my advice to you is that if you're struggling making a decision, it's not fairly straightforward, or you don't, most people kind of know if they want a lumpectomy or a mastectomy. They just know it inside, and based on the recommendations in their cancer, the decision's fairly simple. But if you're struggling deciding which surgery to have because you have the option of both, take your time. Step back. Don't wait months, but you have time to make the best decision for you, because the decision that you make is ultimately the best one for you, because it's your liberty to make your own decisions about your health. A second aspect of this is that I don't want you to feel pressured by your surgeon or plastic surgeon or your family to get surgery quickly before you are ready to make a good decision for yourself. You have time, and if you feel pressured, inordinately pressured by your healthcare specialist, that's where you step back and you stop them. You say, hey, give me a little bit of time. So why do some women choose to have a mastectomy rather than the standard of care lumpectomy followed by radiation? Well, in my experience, personal choice and preference really plays the biggest role. Some women will know and always have thought if they get the tiniest of breast cancers, they will have bilateral mastectomies, remove all the breast tissue, no reconstruction, and they're done. That is who they are. It reflects their inner feelings and the core of their personality. Another reason is that some women fear or are very concerned about undergoing radiation therapy to the breast after a lumpectomy. It usually is required after a lumpectomy, whereas in a mastectomy, you can avoid radiation. And there's some side effects of radiation. It's generally well tolerated, but some women are very fearful of that and want to avoid radiation, so they choose a mastectomy. Some patients are not particularly fit or healthy or can get to a radiation center regularly without causing a lot of stress and discomfort. And they sometimes will choose to have a mastectomy, to have one surgery and be done with it, rather than a smaller surgery and going to a radiation center for 4 to 6 weeks, every day, Monday through Friday. Women that are at very high risk for developing breast cancer, they have a strong family history. They also might be a candidate for BRCA, the breast cancer gene testing. And if they carry that mutation or are at very high risk, they're fearful of getting another new breast cancer in the future in that breast or on the other side, and sometimes choose to have a mastectomy. I'm next going to just tell you about preoperative genetic testing and how that can play a role in your choice. Should I get BRCA genetic testing, the breast cancer gene testing, before surgery? Well, most women do not carry the breast cancer gene. In fact, only a very small percentage of women with breast cancer carry the breast cancer gene. It's under 10%. But if you have a bunch of red flags for carrying the breast cancer gene or another genetic mutation, and if you do carry that gene and you're considering to have a lumpectomy going forward, then you carry a 50 to 60% lifetime risk of developing a second new breast cancer in either breast, the one that had the cancer or the other breast. So that's where you step back and you kind of think how I want to manage it. You can still go ahead with a lumpectomy and manage this in a more intensive screening fashion, But some women will say, hey, I'm diagnosed with breast cancer. I now realize I have the breast cancer gene. Not only I can treat the breast cancer with a mastectomy, but I can remove the other breast to reduce my risk of developing breast cancer. There's not a more complex decision for a patient to make involving types of surgeries, genetic testing, and all of this. So, the key point here is if you're seeing your surgeon and you think that you have a lot of red flags for the breast cancer gene, engage them early on. Will you do genetic testing if I qualify? And it generally takes about 2 weeks to get a result. So then plan your surgery around that. Don't delay it, but plan things so if the results come back to help you make the best decision for you. When you have the choice of a lumpectomy or a mastectomy for breast cancer, make sure you know what's involved, the advantages, the disadvantages of each surgery, and make an informed decision. Ultimately, it's your body, your life, and your choice. To learn more about the decision between a lumpectomy and a mastectomy, visit the Breast Cancer School for Patients, where we actually teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.